and then we go back on the palatal side at least 5 millimeters from the first step of the suture. Then, when we close these nodes, when we can achieve? We can achieve a coronally shift of the flap that move coronally and palatally. So the point is not to close the wound, but is to absorb the tension prior the mattress and single nodes that are creating the real wound closure. So once again, the 3 steps to perform the internal suture and the final closure. And we can see in a short video. So once we have released the flap, we have a mesial nodes to align the flap in a mesial distal direction. We start on the palatal side, 7 to 10 millimeters from the incision line. We catch the periosteum and just the periosteum in the inner surface or face of the flap coronally to the periosteum releasing incision. And then we go back once again on the palatal aspect. Now, when we are closing these nodes, you see that the flap is coming from the vestibular to palatal and from apical to coronal.